we are just very excited and very honored to be leading the observational approach versus surgical intervention for stones, or the OASIS trial. This is a large randomized controlled trial that includes children and adults with asymptomatic stones. And these individuals would be randomized to either observation or upfront surgery to remove asymptomatic stones. It's an incredibly common problem that many millions of Americans experience, but for which we do not know the best approach to take. Kidney stones are really a disease across the lifespan now. 30 years ago, it was a disease of primarily middle-aged men, but over the last 20 years, we've seen stones become much more common in youth. And then now children, adolescents, young adults, and older adults experience these same problems. And one of the most common things is where you're diagnosed with a stone, or a stone recurs after you've had one, but it's not currently causing any problems. And the challenge there is that these stones can move and obstruct the kidney at any time that's completely unpredictable. And that obstruction can cause a tremendous amount of life disruption. That can lead to emergency room visits, hospitalizations, unanticipated surgery that is not planned. Yet at the same time, individuals who choose to undergo surgery at a time of their choosing to remove that stone may experience pain afterwards. They may go to the emergency room or be hospitalized afterwards because of the immediate impact of surgery on their lives. So there's really uncertainty of which of those approaches is better. Do you observe a stone that's not currently causing any problems, or do you remove it before it could potentially cause a problem? And that's really the knowledge that we hope to generate here. This is a randomized trial that will have a 5-year period over which we're going to be starting the study, enrolling patients, and then analyzing the data. Each of the patients who is participating in the trial will be followed for 2 years. And then over that time period, we're going to be understanding experiences such as anxiety and pain, but also emergency room visits, hospitalizations, surgery, and be able to compare those experiences between the two groups. And then ultimately, at the end of this 5-year period, we hope to have that knowledge that will empower patients to make the best decision that will result in the least amount of life disruption for patients going forward of all ages. So we were very excited and honored that the OASIS trial was approved for funding by PCORI. We have had the privilege of working with PCORI as a funder before, and are just incredibly excited about the opportunity to partner together to generate new knowledge that will change lives. And in the next 5 years, I hope to look back and say that we have made a difference in the lives of children and the lives of adults, of those with kidney stones, and that they can make better decisions because of this trial.